Hello friends, welcome to Homeopathy Lecture. Today we will going to discuss about a clinical examination of a clubbing in practice of medicine. So without further delay, let us start our topic. Clubbing. Clubbing, its definition is that it is a swelling when there will be bulbous swelling of the terminal part of the toes and the finger, then due to the increased soft tissue mass and the increased anterior posterior and transverse diameter of the nail due to the subungual connective tissue, then it is called as a क्लॉबिंग. ओके, क्लॉबिंग क्या होता है कि ये हमारा नेल ब्लेड है, नेल बेड. दिस इज नेल प्लेट. This you can see there is a anterior posterior and transverse diameter is found, and there will be a angle is found, that is angle of 160. That is what is oninormal angle. Oninormal angle is there will be angle between a nail plate and a nail bed. There will be a angle. This angle is called 160 degree oninormal angle. When there will be clubbing occur, what happens? This angle is become 180 degree. 180 degree occur, more than 180 degree occur. That is called lobulance angle. Okay, why this clubbing occur? Due to the here the subungual connective tissue is present. If the subungual connective tissue becomes swelling, then it leads to the clubbing. Clubbing means there will be parrot neck like appearance occur or drumstick appearance occur. We will discuss in later. And then what we found in the clubbing, there will be nail plate becomes fluctuate. So this nail plate become fluctuation. When you examine, there will be fluctuation present. There is a definite sign that this is our two thumb. When we get together, there will be a angle is produced. That is called a diamond sign. This is called a diamond sign. Here you can see there is a diamond sign appearance is found, but in the clubbing patient there will be no lace or no diamond sign is found. That is the important diagnostic sign to know the clubbing patient. So there is a grading occur in clubbing. There will be first degree, second degree, third degree and fourth degree. Why clubbing is occur? If a patient having clubbing, you should it is an important sign of infection and neoplasm sign. There will be, if any accessory or innermost infection is present or any type of cancer is present, then clubbing must indicate on the nail. This is important sign, but this is not a diagnostic character. There will be many people who is having no infection, but they have the clubbing finger. So we will discuss why clubbing occur, what are the causes of the clubbing. Grading. In primary grading, there will be increased fluctuation. When you press, there will be a fluctuation present because of a loss of onicodermal angle. What is onicodermal angle? We discuss the angle between the nail bed and the nail, that is 160 degree. If 160 degree more than 180 degree occur in the clubbing patient, and if there will be onicodermal angle is less, there will be fluctuation increases. Secondary, what is the secondary criteria? Secondary is that primary criteria plus increase in anterior posterior or transverse diameter of the nail. That is, nail become glossy, smooth, and longitudinal ridge of the nail become lost. So that here it is another a longitudinal ridge we find in a normal nail, that is absent in the clubbing patient. In tertiary, there will be all the sign of a secondary is present in tertiary with increased pulp tissue. There will be pulp tissue become so much increase, like inflammation, like sign you think. Then in 4th degree, that is tertiary plus wrist angle swelling due to the hyperpulmonary osteoarthropathy, HPOA. It is important clinically. Examiner always asks what is HPOA. Hyperpulmonary osteoarthropathy, mainly seen in which carcinoma? Bronchogenic carcinoma. Bronchogenic carcinoma. What happened in hyperpulmonary osteoarthropathy? Its name suggests pulmonary means lungs. Osteo means there will be osteo means bone. The bone osteoarthropathy means periosteal new bone formation will be found in the osteoarthropathy at the lower end of the radius ulna tibia fibula, that is a long bone. In long bone, there will be found in the subosteal new bone formation in HPOA, that is hyperpulmonary osteoarthropathy. Okay. Up to this you understand, so let us discuss few seconds. That is, we discuss the clubbing definition, what is the sign of the clubbing patient, and what are the gradation of the clubbing, and the most important sign of the clubbing we discuss. Now we discuss about investigation of the clubbing. How we investigate? You all is because X-ray is the investigation criteria, because there will be bone osteoarthropathy occur. That's why X-ray, from X-ray you can understand the bone feature. From this you can suspect the clubbing is present. That's then wrist ankle X-ray you can find from the area investigation of a choice is clubbing. Then clubbing, there will be another mnemonic I found for the causes to remember the causes of a clubbing. How to remember causes of a clubbing? So causes of a clubbing is C for cardiac causes. What are the cardiac causes? Tetralogy. What are the Phalotetralogy means in newborn patient there will be in heart there will be what happened in the valve of anterior atrium, right atrium and left atrium, there will be a opening occur. That's why the blood, oxygen and deoxygenated blood is mixed together, which leads to phalotetralogy. In phalotetralogy, tetralogy means there will be 4 conditions present. What are that 4 conditions? VSD, ventricular septal defect, pulmonary stenosis, obstructive aorta, right ventricular hypertrophy. So we discuss after that one by one all these terms. Phalotetralogy with subacute bacterial endocarditis. It is the first most common cause of a cardiac cause of a clubbing. You should remember it. At least this thing you should remember. That is SEM, endocarditis, subbacterial endocarditis, SEM. Then it leads to mitral and aortic valve congestion, leads to cardiac tumor, atrial myxoma. That is the cardiac causes of clubbing. Then in the lung there will be bronchostasis, bronchogenic carcinoma, lung abscess, cystic fibrosis, pleural mesothelioma, empyema, and a fibrozyme alveolitis. In U for ulcerative colitis, leads to GI tract. B for biliary cirrhosis, another is absent. I for intestinal cause like Crohn's disease. These are inflammatory bowel disease. Okay, then N for normal patient also having clubbing. In G for genetic. That are the causes of the clubbing. Then types of clubbing. Clubbing is a 2 type, that is parotonic appearance and drumstick appearance. In parotonic appearance there will be due to the bronchogenic carcinoma there will be parotonic appearance, means lungs involvement if occur then it is parrot. Drumstick appearance there will be heart involvement, that is phalotetralogy. And SABE, that is important, SABE, subacute bacterial endocarditis. This is all about the clubbing causes. Then there is another type of a classification according to sign and symptom, that is painful clubbing. Painful clubbing we find in bronchogenic carcinoma and the subacute bacterial endocarditis. Unilateral clubbing. So painful clubbing, when you press there will be pain. Unilateral means only one part of the hand or one part of the leg, that part is only goes on clubbing. That is bronchogenic carcinoma, aneurysm of subclavian artery, and a pre-subclavian coagulation of aorta. Important. Okay. Other thing is that digit is undergoing clubbing. That is if any type of a trauma or that causes unilateral finger clubbing. Hereditary, rarely due to the median nerve injury. And sarcoidosis also causes due to neoplasm. There will be sarcoidosis. There it causes also digit, unilateral finger or digit clubbing. Only one finger or anything will be clubbed. Then clubbing limited to upper extremity. That is if any person who is a chronic drug addict like heroin, there will be chronic obstruction of a phlebitis. Phlebitis means vein, inflammation of a vein. There will be vein inflammation with obstruction. That's due to the heroin abuse. Clubbing limited to lower extremity. That is abdominal aortic aneurysm, means dilatation of the abdominal artery. Okay, acute clubbing when occur, there will be clubbing develop after 10 to 14 days of illness. It is developed very rapidly and mostly children are sufferer of that acute clubbing. Why clubbing occur? Due to subungual connective tissue swelling, there will be increase in subungual connective tissue. Due to interstitial edema, due to arterial and capillary dilatation, due to clubbing associated with cyanosis, clubbing associated with dyspnea. This is all about the clubbing. And what are the mechanism of clubbing? 3 mechanism: PD, chronic hypoxia, hormonal mechanism. What is PD? PD means platelet derived. There will be, if there will be infection secondary to acute phase reactant, that is CRP protein, when comes on that infection area, it release PDGF, platelet derived growth factor, which leads to clubbing. In hypoxia, there will be systemic vasodilatation, which leads to blood supply, increased blood supply, which leads to increase in soft tissue proliferation, which lastly leads to soft tissue proliferation, which leads to clogging. Okay, hormonal, some hormonal like your growth hormone. If any person who is acromegaly, then obviously the all the fingers are very large like this length. That's why there will be clubbing also occur.